Hello, nice to meet you. My name is Seong-Ju from Jeonnam National University Hospital. This is my great honor to present our study about nationwide surveillance of antimicrobial resistance for uncomplicated cystitis in 2023, conducted by the Korean Association of Urogenital Tract Infection and Inflammation. Before describing the main result, I would like to briefly explain the background of this study. UTI is one of the most common bacterial infections in women. Half of all women experiencing at least one episode of uncomplicated cystitis during their lifetime. In addition, at least 30% of whom will experience a recurrence within 6 to 12 months despite acute treatment. The most frequent causative bacterial pathogen with uncomplicated cystitis is E. coli. Recently, antimicrobial resistance has been rapidly growing, which makes no longer respond to antimicrobial agent and difficult to treat UTI. In addition, much drug-resistant bacteria have gradually increased that increase the risk of disease spread, severe illness, and death, consequently leading to serious socioeconomic burden worldwide. So, it has been considered as one of the greatest threats to global health, even more than global warming. So, systemic surveillance of antimicrobial resistance is especially important to obtain correct information on the microbiological characteristics of the community and select the optimal antibiotics based on the corresponding antibiotic susceptibility information. Recently, the Korean Association of Urogenital Tract Infection (KAUTII) established a monitoring system for surveillance of antimicrobial resistance, which name is COMS for UTI. COMS for UTI is an internet-based study and now ongoing with the cooperation of Korean nationwide medical centers. This is the homepage address and main page. You can click this section to enter your UTI data. At first, input nationality and then input age, sex, outpatient or inpatient, association, classification of UTI, recurrence or not, antibiotic used within previous 3 months. And if a woman, input additional data about menopause. In addition, based on the result of urine culture, answer the type of bacteria, ESBL positive or not, and susceptibility according to each antibiotics. In 2023, 35 urologists of Korean nationwide medical centers were participating in COMS for UTI by inputting the data of patients with UTI on the website. So let's talk about the result of COMS for complicated cystitis. A total of 885 cases were included in 2023. Regarding the region of the hospital, Gyeonggi account for 43%, Seoul 28%, followed by Jeolla, Gyeongsang, and Chungcheong province. And by the size of the hospital, primary medical centers account for 33%, secondary 42%, and tertiary 15%. The mean patient age was about 56 years, and among a total of 885 patients, the number of postmenopausal women, community-acquired UTI, and recurrent cystitis were 64%, 98%, and 11% respectively. The rate of ESBL positive was 13.7%. Regarding the distribution of organisms, E. coli was the most frequently identified viral pathogen, 75%, followed by Klebsiella pneumoniae and Enterococcus species. The results of antimicrobial susceptibility are summarized in this table in detail. 95% were susceptible for fosfomycin, 90% to nitrofurantoin, 80% to amoxicillin clavulanate, 58% to ciprofloxacin, 84% to cefotaxime, and 100% to orthopanem. As a result, resistance rate for Urol pathogen of uncomplicated cystitis to ciprofloxacin and cefotaxime were 41.6% and 16.4% respectively. We compare the result of ESCRL positivity, full clonal resistance, and third generation cephalosporin resistance according to clinical factors. Regarding hospital region, clonal resistance was significantly higher in Gyeongsang and Jeolla province. According to hospital type, all of that were significantly higher in tertiary hospital. In addition, in postmenopausal women, ESCRL positivity, clonal resistance, and third generation cephalosporin resistance were 5%, 20%, and 8% more than premenopausal women, respectively. There was a significant statistical difference. In patients with recurrent cystitis, all of that were approximately 1.7 to 2 times higher than another group. We compare these data with the result of other previous studies, and now I'm going to tell you about that. In previous report of South Korea 15 years ago, the resistance rate for quinolone and third generation cephalosporin were only 25% and 5%, but now those of that are 42% and 70%. In just 15 years, quinolone resistance has nearly doubled and third generation cephalosporin resistance has tripled. I think this is a serious problem. Next, comparison with recent Japanese nationwide study for quinolone resistance of Korean premenopausal and postmenopausal women were 15% and 13% as high as in Japan, respectively. Even considering the differences in the type of representative fluoroquinolone used by two countries, fluoroquinolone resistance in South Korea has already been reached serious level. Therefore, fluoroquinolone should be no longer used as an empirical antibiotic for complicated cystitis. In summary of the result of counts for UTI in 2023, a total of 885 patients with uncomplicated cystitis were included. Most common Urol pathogen was E. coli, account for 75.1%. The rate of ESBL positive was 13.7%. The resistance to quinolone was 41.6%. A high prevalence of fluoroquinolone resistance was presented in tertiary hospital recurrent cystitis and postmenopausal women. In addition, significantly high fluoroquinolone resistance was observed in the current data compared to previous Korean study and recent Japanese study. So, based on this result, the current situation of antimicrobial resistance in Korea was too serious, and a lot of effort should be made to reduce antimicrobial resistance. Thank you for your attention.